You are live. Good morning. Good morning. Happy Monday. And welcome. I'm glad to see you. Of course, I'm Angela McGowan, your professional healthcare advocate and caregiver strategist. I help you navigate through healthcare sea of red tape, and I create strategies that allow you to give excellent care and care for as you care for. I'm asking you to be a part of StreamYard. You can go there, bit.ly/stream for you and download the free app. And you can also join me live if you would like to. I'd love to have you on. Let me share. And I'm also asking you to share the broadcast. I'm going to share it now. And I'm attempting to, and I tell you, sometimes the spell check, it's not all that it's cracked up to be. All right, and especially if you are 65 or if you have parents in that age. Yes, okay. Unable to post that. Sorry it took me so long to post. But anyway, thank you for being here. Yes, Angela McGowan. I'm the author and publisher of How to Get Out of the Hospital Alive. And this is something that you need to know. You might not be in the hospital today, but somebody you know is in there, and it would be great for them to be able to get out. All right. Of course, the number one method I always say is not to have to go there in the first place. And that book does detail many things on how you can get excellent health care from your physician, especially if you know how to ask the right questions. That is always, always awesome. Hey, Sister Darlene, how are you? Good afternoon. It's still morning here on the West Coast. That's right. Guess I get my little brag on. I don't know. It's still morning time, but then you guys have been up a long time. So welcome to Medicare Monday with me. I'm Angie's Pace. I'm Angela McGowan, and I'm talking about Medicare and diabetes care. Are you going to get care for your diabetes from Medicare? So that's why I have invited people that are 65 older or know people that are that range. Because even though Medicare enrollment has ended in December, as you become 65, hey, open enrollment is for you. And so I want to talk about this because there are a lot of people that do already have diabetes and may think of it as a pre-existing condition and something that they would not. That's right. Thank you, darling. Good morning. And something that they might have problems with when they sign for Medicare. So, of course, signing for Medicare A is your hospitalization. Medicare B is the part that pays for your physicians. So now listen, if you already have diabetes and you come into Medicare, then there are things that you will get from Medicare Part B. You will get impaired glucose tolerance. You'll have high fasting glucose, hemoglobin tests. There's a lot of things that are going to happen for your good. All right. Once they're positive that this is it, you haven't done your self-diagnosis, then they'll cover you for 10 hours of diabetes self-management training, which means you will usually have a nurse practitioner that will go over a lot of things with you on how you can take care of yourself and have your best possible health, okay? And even improving on your health. You will get eye exams, a yearly eye exam, because we know those people who are diabetics usually are attacked with glaucoma. So you're going to get that. You're going to get foot care. A lot of people don't know that. It's not a trivial matter when it comes to diabetes. Medicare does not cover routine foot care, But if you are diagnosed as a diabetic, you will get foot exams every 6 months. If you need insoles or things like that, and you have suffer from a diabetic neuropathy, then those are specialized visits, and those too are covered. Even to the point if you need special shoes and insoles, as I said, because of that. Now you do get the administration things for your insulin. So you get the syringes, you will get the test strips, you can get a monitor, all of those approved amounts. But when it comes to insulin, because usually there's not a generic so-called, is very pricey. Now, there's two ways you can handle it. The first way is you can go to your pharmacy, get your insulin, and you'll be paying about 20% or more. To not do that, you could also sign up for one of the Medigaps when you come in to Medicare. And if not, Medicare themselves has a mailing program where they mail everything to you. Why wouldn't you want to? I know several people that have been taking advantage of the mail pharmaceutical part of Medicare, and it's been great because guess what? You don't run out. It's automatic. It comes to your door, and it's just a wonderful program. So that's what I would suggest. But let me just tell you, if you're a diabetic, you become 65, you get into Medicare, and this is even if you're not diabetic. When it's time to sign up for Medicare, ladies and gentlemen, do so, because there's what they call assured time frame. That's 90 days. You can do 60 days before and be ready, 30 days before, 30 days after your actual birthday without any penalties. If you sign up afterward, especially for Medicare Part A, you will be penalized for that. Even if you've never gone to the house, it doesn't matter. You're going to be penalized for being late. So, hey, you know when your birthday is coming. If your birthday is March, you're already late signing up. Get started, okay? If your birthday is in April, you're right on time. So keep up with this. This is so important. Now, of course, you know, Medicare has lots of parts. I did a Facebook that said, how many parts does it take to make a whole? And I'm going to go back and finish that. We know you have Medicare Part D. That's the prescription part that is going to cover your medication if you decide to go to the pharmacy. But let me assure you, it's not going to be covered at 100%. So that's why you will need to get Medigap. But if you take advantage of the mail Medicare program for their drugs, you're going to be doing just fine. So that's what I wanted to give you the information about Medicare Monday. I also wanted to share some information since we're talking about the medical field for Black History Month. And so the person that I'm spotlighting today is Charles Richard Drew. He's a pioneer in blood banking, and he did extensive original research in blood chemistry. He's considered a barrier-breaking African-American doctor and surgeon who earned the title of the father of the blood bank for his life-saving innovations in the use of preservation of blood plasma. And here's just a highlight I'd like for you to know about Dr. Drew. Dr. Drew. In 1940, he did his doctoral thesis on banked blood because he had found a way to separate the whole blood from the plasma, and even went on to find out how to do the plasma and make it dried cells, which England used during their time of war and during World War II. Exactly. And here's something I really want you to know about this, about the main ingredients from the red blood cells, the oxygen, the plasma. This is something that what Dr. Drew did during that time, by the time for Britain had concluded in January of 1941, he had more than 14,000 blood donations, and they had 5,000 liters of plasma that they had shipped. his blood banking moved to a national scale. All right. After this 3-month program, it served as the template for the National Blood Service. Drew returned to Howard University to pursue, of course, his long-term goal of being have the surgical program from African Americans. But what he did in the blood industry, let me get right to that part. Okay, that's something, yes. That's something else. What he did, his program is what piloted what we have for our blood bank, even the mobile blood banks. He is credited with what he did, the way he was able to save it, and actually getting donors in. So what we know as the American Red Cross, he is the one who, that's why he's called the father of it. He is the one that made that be able to be on a national level. They used everything that he knew and that he provided, and that's why we have it on such an awesome level right now. So we want to give up, definitely want to recognize Dr. Charles Drew. And he did, here's something you need to know. Dr. Drew did move away from the Red Cross because it was found after the program that the Red Cross actually would segregate the donations from the whites and from the blacks. And when that happened, he withdrew from that and went on to become a pioneer in getting African Americans to be surgeons. So a lot of critical things happened. He pioneered. And so I want us to not just, a lot of us here, we know Dr. Charles Drew, but let's make sure that we are telling generations down, because he did a lot. He has definitely did a lot for African Americans who wanted to be surgeons, because he piloted that program. But before that, before in his doctoral studies, he is the reason that Britain and now the United States has this American Red Cross, that they were able to do it on such a vast level as well. Hey, Chiquita, how are you? And, I want us to be proud of everything that's going on with our heritage. And I want us to spread the word, to tell people what is going on. African Americans, now, we all know we didn't just raise our hand and volunteer to be here. But when we got here, we made the nation what it is today. And so every time, black, white, red, brown, yellow, pink, purple, every time someone gives blood and every time somebody receives blood, it has everything to do with an African American doctor, and his name is Dr. Charles Richard Drew. Thanks for sharing, Chiquita, and you need to know that, and you need to be talking about it, and of course, be proud of it. So one more thing I want to share with you, and that is on this Thursday, we're going to have Let's Talk Live with Angela McGowan, and my special guest is going to be Trinette Stanford. She is a nurse practitioner, and guess what? She's going to be talking about pre-diabetics. This is American Heart Month, and guess what? You need to know what's going on. If you have been diagnosed as pre-diabetic, or anyone in your family, you need to know what's going on and what that means about your heart. A lot of people think, well, if I'm not a diabetic, well, I'm safe. No, pre-diabetes has more of an impact on you than you may know. And so that's going to be at 5 p.m. Central Standard Time, 3 p.m. Pacific Standard Time. That's where I am. But I will be joining together right here live, Facebook or StreamYard. I'd love for you to be a part of it. And as always, if you would like to have a 20-minute results call with me, I'd love to speak with you. You can schedule that call at bit.ly/Advocate Angie. So Medicare Monday, that's what we did today. If you're 65 or you're turning 65 or your parents are turning 65, check your birth date. Make sure you do not pass your issue date, because you come in pre-existing conditions, nothing matters, but you have to get in on time. If you get in late, not just a penalty, they can deny you from Medigap, and those are the other parts that you have for Medicare. All right. Thank you so much for joining me. I really appreciate you. And always, it's blessings and joy. They both belong to you. Have a great week. I'll see you again on Thursday, 5 p.m. Central Standard, 3 p.m. Pacific time. We'll be talking to Trinette Stanford. Be blessed, everybody. Bye. Have a great one.